we have a very common belief in our society that the fainting is often attributable to low eating or low blood pressure in normal population. So partly it is not completely supportable from my understanding, because in general a person who is not taking good amount of food or diet is not going to lose his or her BP, or you can say he or she is not prone to develop fainting very suddenly. Now, what actually happens in normal situation when we don't take food properly or adequately? Definitely we may feel giddy or lethargic because we don't have that much of energy level which we often get or obtain from our foods. But it is very difficult to lose that consciousness or that tone so that we can just fall down in the form of fainting, or we can just get the blackout, which is very difficult to believe because of the less eating, or which is attributable to low blood pressure. Firstly, let me tell you something, that low eating is not proportionally related to low blood pressure, because our body is tuned or designed in such a way that even though a person will not take proper amount of food, he or she will be enough empowered to maintain his or her BP, and this will never go into that kind of situation where he will develop syncope or fainting. On the contrary, if we believe that a person, despite getting good amount of diet, is losing his or her consciousness or getting repeated fainting, then we have to think about some other problems which can actually lead to low blood pressure. So basically, the fainting is not attributable to less eating first of all, but it can well be attributable to low blood pressure, which is called hypotension. Now, in general, we don't have that kind of situation where a person being healthy in body and mind, especially from his cardiac point of view, develops this kind of problem of fainting. That means if a person doesn't develop stroke, or if a person doesn't develop any cardiac illness, doesn't actually go into that kind of low blood pressure which leads to fainting. If a person who is just having a fainting attack and just presuming this problem as some gas or some dyspepsia or digestion problem, can well be evaluated for having cardiac illness, and those patients should actually require some kind of further workup in the form of ECG, echocardiography, or some other advanced modalities of investigation like TMT, or even sometimes they may require Holter or some other workup. Basically, this is not our low intake or less intake of food which can cause hypotension followed by fainting. Rather, we need to go for searching something else which may be responsible for this kind of situation. Thank you.